Hello everyone, I'm Dr. Aditya Bhati. I'm into this field for last more than 17 years. So I've been getting many queries about neurological problems in youngsters. So I'll be addressing those neurological signs and symptoms and diseases in young. I have got many queries. One of the query is that what are the neurological signs that youngsters must be aware of? So most importantly, youngsters usually present with headache. When the headache is continuous, not relieved with medications, it has drowsiness or blurring of vision, then he must visit a doctor. That is for first and foremost. Headache severe enough that it has symptoms, other symptoms, that is neck stiffness, vomiting, blurring of vision. He has to present. Part 2 is seizures. Whenever a youngster has a seizure, he has to be investigated. Actually, everyone has to be investigated, but in youngsters, they have to be treated as soon as possible. The third important thing is that low backache. When the young patient has low backache and they are more prone to it because they are enthusiastic, they are more into the gyms, and most of the days they are lying on the couch and the physical activity has reduced. These can also cause severe low backache. When the low backache is associated with radiating pain to the legs, not responding to medications, it is associated with weakness or numbness of the legs. Along with it, when there is bowel bladder disturbance, that is, there is difficulty in urination and there is constipation, he has to visit a doctor. One of the other causes when the patient has high-grade fever. When the patient has high-grade fever, along with it, when it is associated with headache, neck stiffness and drowsiness, that is, this could be a meningitis, that is inflammation of the meninges of the brain, that is brain infection. These are important neurological diseases or signs. As I said, these have to be immediately attended to and they have to visit a doctor as soon as possible. I've gotten another query that people ask, at what age usually the neurological symptoms are more common. See, neurological problem can occur at any time. It can occur immediately after the birth to the elderly age group. It can occur at any age group. In the young or the newborn, there could be some developmental problem. After that time, they can develop some infection inside the brain that could lead to increased water inside the brain. That's called hydrocephalus. When the baby grows or the child grows, he could have some infection or some developmental malformation of the back that could lead to weakness of the limbs. And there are some tumors which occurs in the young. The neurological signs and symptoms doesn't depend upon the age. They act accordingly. Youngsters more prone for trauma. They have head injuries, spine injuries. In the elderly or in the middle age group, they have tumors. They are metastatic tumors. Elderly, they will be having more aggressive tumors. So neurological signs and symptoms are there according to the patient's disease. So it can occur at any age group. See, whenever a patient has severe headache, not responding to medications, along with that vomiting, blurring of vision, or if there is any facial asymmetry, or there is any weakness of the limbs, or there is difficulty in urination and bowel passage, that means the patient has to visit a doctor. Other than that, if he has unilateral facial weakness, unilateral facial pain, unilateral facial flickering movements, or weakness of the arms, numbness of the arms, these are neurological problems. Whenever the patient faces these, they have to visit doctor nearby. The red flags of the neurological symptoms are any paralysis, weakness, numbness, bowel bladder disturbance. When there are neurological signs in a patient, they have to visit the nearest doctor. Then doctor would properly examine him in detail, take the detailed history, followed by relevant test. The most important tests are the blood tests, which are very important, and some tests are specific to some problems. Like when there is anything related to the brain, so then the MRI would be done. If there is any related to the brain, but because of the trauma, the initial test would be CT scan. Because in the CT scan, the blood can be seen easily and it is very easy to do. In 1 minute, the CT scan would be done. That will be an emergency. But MRI takes little time. It may take from 25 to 30 minutes. So it is little longer. And the next is the X-rays. And these are usually done when there are fractures. So next, other than that, in rare cases, in few of the cases, we do NCV or EMG test, in which nerve conduction velocity we check. In that, we will able to localize the problem where exactly the nerve conduction is lost. And apart from this, in MRI, there are other sequences like spectroscopy, tractoscopy. These actually are done according to the patient's condition, according to the patient's disease, to be specific. So how do you treat these neurological disorders? So the management includes according to the cause. When the patient has tumor, when there is small tumor, when there is small tumor less than 2 into 2.5 centimeters, then these can be treated with radiation. Other than that, when there is large tumor having mass effect, they will be treated by surgery. That is called craniotomy. When there are tumors of the spine, so spine surgery is being done. When there is fractures of the spine, there is fixation of the spine. There is decompression along with fixation of the spine. There are different things. When you talk about latest in neurosurgery, the first and foremost is neuronavigation. We all know what is navigation. When you are moving around, actually it guides you where exactly you are in the brain. So the tumor decompression is done very well. Along with that, you can actually salvage important structures of the brain. So it really helps. This is the latest technology. Other than that, there are other gadgets in the theater room with high-end microscopes, which actually help us to better illumination and magnification. So that is another part. The microscopes have to be higher end. They actually help the neurosurgeons to better perform the surgeries. People ask me, how safe is neurosurgery? See, it will depend upon the patient's conditions and the problem. When there is high-grade glioma or high-grade tumors inside the brain, you take out as much as possible, which is seen on the CT, MRI, and also during the surgery in the microscope, and along with those adjuvant navigation techniques. So when you take it out, then there will be the chances of recovery will be high. It depends on location of the tumor. When there is tumor located in the important structures of the brain, then you will try to take it as much as possible, and you will leave little bit so that the patient will not have fresh neurological deficit because of the surgery. So it depends upon the tumor type, its location. So overall, you can say that the technology has increased. So neurosurgery is in these days, in modern neurosurgery, is a safe surgery, and it has been risen its level, and day to day the technology is getting better, so the outcomes are better.